you want to text a friend, let them know that you're on this free virtual seminar. If you have a friend or a family member who might be interested in choosing a career in healthcare, this is for them. We're so excited that you're here, and we have an awesome panel of some awesome women who are going to speak tonight who are beginning a career in healthcare, they're working in healthcare, or they're veterans in healthcare. And that's the good thing. You're going to get a full gamut of healthcare. And maybe this is a field for you and maybe it's not. However, this is the place to be when you're trying to figure out if this is something that you want to pursue. So I want to say once again, come on in, find a seat, let's get comfortable. We want to welcome you to choosing a career in healthcare. And this free virtual seminar is being brought to you by YB Consultants, LLC, it's a medical consulting firm, as well as Berry Communications Consulting Services. And I'm going to be your co-host. I'm Kristen Berry. And your other host is also going to be Dr. Yabo Bisolo. And we're going to guide you throughout tonight. And Dr. Bisolo, you can go ahead to the next slide, and we're going to just go ahead and get started. And we hope that you will have some great information, but also pull out those questions. And so if you're like me, I forget stuff. Maybe get a piece of paper, or most of us have our phones, and jot down those questions so that you don't forget. All right, we have some panelists, some awesome panelists tonight, and I want to introduce them to you. All of them are on different tracks, as you're going to see, and I'm going to introduce these three awesome women to you, and we're going to get some more information from them and the different tracks that they find themselves on. So first, I know this young lady just a little bit. First is Raven Berry. She's a freshman at Albany State University this year. And Raven has a particular niche here. She's a biology major, and she also obtained her CNA training while she was in high school. So she's going to talk to us tonight. She's a brand new freshman, but she's going to talk to us tonight about getting into the healthcare field with dual enrollment, especially if you're a Georgia resident, or if not, we'll talk a little bit about how dual enrollment can work for you as well. I want you all to also welcome McFrancis George. She is a certified family nurse practitioner and a certified RN in med surg. She's a family nurse practitioner at a busy practice, and she's a clinical nurse faculty member at Kennesaw State University. Next is Dr. Danielle Bisolo. She is a school psychologist in Montgomery County, Maryland. These three awesome women have some great things to share with us tonight. And Dr. Yabo, all right. And our panelists that are going to be on part 2, we want to introduce them to you as well. Miss Sadia Bisolo, she is a senior, yay, senior at University of Georgia. I know she's glad to see that senior status. She is a public health major. And so we're going to get a different kind of flavor about starting a career in healthcare. We're going to talk about public health as an option as well. And she has a pre-med concentration. Also want to introduce you to Olivia Lane. She's in the master's program at Drexel University in Pennsylvania. She's a graduate student there, and she is pursuing her master's of science in biomedical studies. Awesome. Next is Miss Sydney Ray. Sydney is a third-year medical student at the Kansas City University College of Osteopathic Medicine. I'm going to figure out what that is because I had to ask what that was. And next is Basia Bisolo. She is a doctor of osteopathic medicine. Y'all gonna correct me if I got that wrong. She's a family practice resident, and she is studying at the Morehouse School of Medicine. And well, you met one of the moderators. That's me. I'm Kristen Berry, one of the moderators tonight. I've worked in communications and radio and am the owner of Berry Communications Consulting Services. And it is also my awesome pleasure to also introduce to you our moderator, Dr. Ayabode Baisalo. She is a medical doctor as well as holds a master in public health. And she's going to tell me what the other ones stand for because she's a pediatrician. She's a pediatrician of over 20 years of experience, and she is a public health professional. She does it all. She has a lot of expertise in global health and mission work, and she's the awesome owner of YB Consultants that's bringing you this awesome seminar tonight. Now, we do just want to give you a just brief disclaimer that you're going to hear a lot of great information tonight, but remember that the opinions that are being expressed tonight in this presentation and on the slides that you're going to see coming forth are solely the opinions of the panelists, the individual panelists, and not necessarily of any type of institution that they attend or where they work, okay? And we also want to let you know that these sessions are being recorded, okay, and they may be published on various media platforms, including print and audio and video formats without any further notice. Also, we want to let you know, just in case if you need it, there's the Zoom call-in, there's the Zoom link, there's a call-in number, and the passcode if you need to forward that to a friend.
Okay. Thank you so much, Kristen. Thank you so much, and welcome everyone. It's such a pleasure to have all of you on. We really want to thank you for taking the time out this evening to be here with us to learn a little bit more about careers in healthcare. Especially want to thank all of our panelists. These are all accomplished women whom I consider as role models for their hard work, their determination, and their resilience. Every one of them has put aside their daily work, school, and family duties, not only tonight, but as we prepared for tonight, just to give back to others. So we want to thank you for your selflessness. So why are we here? We wanted to put this panel together for several reasons. One was to raise awareness of the multitude of careers in healthcare. When we think of healthcare, sometimes we only think of doctors or nurses, but the path is so much wider than that. The multitude of careers exists, including speech or physical therapy, ultrasound technician, nurse anesthetist, optometrist, to name a few. And then we have the non-clinical side as well, and that can include healthcare administration, healthcare management, billing, and coding. So this virtual career fair is just to give you a little snapshot of what exists in the healthcare arena. And we also realize that because of the pandemic, a lot of schools are closed. And normally this time of the year, a lot of health fairs as well as career fairs may have taken place, but because of the pandemic, that is not happening. And so we wanted to give you this opportunity to delve a little bit more into healthcare careers. We also wanted to ensure that those who are interested in healthcare have a clear understanding of sometimes the tight deadlines and timelines in order to ensure a smooth transition to avoid delays in schooling and potentially avoid financial debt by choosing a different fork in the road. And it was important that we let you hear from those who are going through this right now, either in school, those who are recent grads, or relatively new entrants into the workforce. So before we get started, we wanted to ask you to answer a couple of questions for us. Some of you have already registered and done so, so we'll put up our first poll. And if you could just answer the question here, and we'll share the results shortly. About half of you have voted so far. We're waiting for the other half. Okay, for the sake of time, we'll stop there. And we see that the majority are college students, and we also have some high school students and grad students, and some who are taking a gap year or have completed schooling. So those are results there. All right. And our second poll, what's your healthcare field interest? If you could take just a second to answer this question as well for us. Excellent, excellent. Okay, let me share these results with everybody as well. Great, so a wide range of interest here in those who are attending. So again, we thank you for being here this evening. Now we'll move straight into speaking with our panelists. We know that's why you're here, and we'll get some information from them. So the way this will be set up, we have about an hour this evening, and we'll speak to our first three panelists. We'll have a brief Q&A, and then we'll move on to part two and speak to the remaining panelists. So we'll start with Miss Raven. Raven, I'm so proud of you and your accomplishments so far. You're a freshman in college, biology major. We had some very interesting information about you being a CNA. So walk us through that. How did you get your CNA as a high school student? That's very impressive.
So as a high school student, I obtained my CNA license through dual enrollment. And usually it doesn't take as long to get your CNA license, but for me it took 2 years balancing it with high school work and college. And yeah, that's how I got it.
Okay, okay. And are you planning on working as a CNA while you're in college?
Yes, ma'am. I do plan to take my boards and then work as a CNA. Not this year, since it's just my freshman year. I want to focus solely on, something new. But in the next years, I do plan on becoming a CNA.
Now you mentioned your boards. What is that? Is that like a test you'll have to take?
Yes, ma'am. It's a test to be actually certified, like to be an actual certified nursing assistant. And when you take your boards, it's I wouldn't say it's a big test, but it's a very important test, and you demonstrate, the skills that you learned during your class and the lecture portion of the class, and you just
Perfect. Excellent, excellent. So what are your next steps, Raven? Where do you see yourself in about 5 years from now?
In about 5 years, I hope to be finished with undergrad at Albany State as a biology major, and hopefully going on to med school.
Excellent, excellent. And the slide that everyone can see here shows the difference between a CNA, which Raven is right now, and a medical assistant, because we hear those terms sometimes used often when we visit our doctor's offices. And you can see there with a CNA, as Raven completed 4 to 12 weeks of schooling for that. And that can be done as part of dual enrollment. On the bottom left of the slide, we have a website for georgiafutures.org. And you can go there to find out more how your high school student can dually enroll in a college, technical, private, or public college in the state of Georgia and get it paid for. Raven, tell us a little bit about the clinical hours there. Did you have to have some hours where you worked in a setting?
Yes, ma'am. So during the actual course, we did have to do about 16 to 100 hours. I think I did about 100 hours during the course, and then at the end you'll do clinical hours, like actual clinical hours in a facility. But due to corona in my situation, we had to do them at our school. I went to Atlanta Tech. I was at Atlanta Technical College, so we had to do about, I think they reduced it to about 24 hours for us to finish the whole course, and just the lecture hours. So
excellent. So that's a lot of experience, a lot of great experience. And someone had asked, one of the attendees had asked, does working as a medical assistant or CNA help you with medical school applications and count as patient care hours? And it does. It looks excellent on your resume that you've had this experience working with patients directly. So we look forward to seeing Raven in the future and all the good stuff that God has in store for you. So thank you, Raven.
Thank you.
We'll come back to you again shortly. Next, we'll move on to nurse practitioner Mac Francis, George. And Mac Francis, how are you this evening? Let me make sure I mute her. There we go.
Can you hear me?
Yes, we can hear you now.
I'm great.
Okay, and thank you. I know you rushed in from work. Busy day at the office. So walk us through your day as a family nurse practitioner.
Oh man, so I've been a family nurse practitioner for roughly about 4 years. This August made 4 years. Typical day, we see anything from birth to death and dying. A typical day in the offices, we're seeing patients with multiple chronic illnesses, along with a little bit of pain management. We're dealing with their chronic issues. Patients are coming in for medication management. I am the walk-in nurse practitioner. So I see a lot of walk-in patients who, are new patients to the practice, who some of them have never even been to a doctor's office before. So it's a lot of critical thinking, a lot of planning and assessment, and a lot of diagnosing with patients who have no idea what their health history is.
Wow, excellent. So as you can hear from Mac Francis, it's definitely a gamut of illnesses that you'll come in contact with. And when you walk into a physician's office or a doctor's office, you'll either see Mac Francis as a nurse practitioner, you may see a physician assistant, you may see a physician. So we just wanted you to be aware of the myriad of healthcare professionals that you'll be able to see in a clinical setting. And you wear different hats. We know that you're a family nurse practitioner now. Before that, you were a registered nurse. And for those who may want to know a little bit about nursing school, walk us through that a little bit, and I'll put a slide up as you talk.
So for me, it was a little bit different. I had the ability to actually go in. I went to the University of Rhode Island, where I was born and raised, and I actually worked as a registered nurse where I obtained my BSN in nursing. I worked there for roughly about 2 years as a med-surg nurse, and then I moved to Georgia in 2009, and I worked at Wellstar Hospital for roughly about 5 years with med-surg, cardiology, as well as vascular specialties. And then I worked at Emory Midtown for roughly about 5 years before I graduated with my master's, and I did nephrology. I delved into dialysis for about 5 years before I went to obtain my master's and become a nurse practitioner.
Wow, excellent. You're saying all these years, and I'm looking at how young you look. Doesn't seem like I know this already.
But as I was doing that, I really never left a job. When I left Wellstar to go to Emory, I just ended up being PRN. So I kind of went into each position while still working as a nurse at another hospital.
Wow. Excellent.
So roughly it's about 13 years.
Wonderful, wonderful. And so if someone's thinking of becoming a nurse, do they go to nursing school? Do they go to college? What's the pathway?
So what you're going to do after you graduate from high school, you're actually going to decide, one, if you want to be a nurse. Why do you want to be a nurse, and what kind of a nurse you want to be? Because there's different areas in nursing. You can either be a LPN, a registered nurse, which we call an ADN nurse, or you can be a registered nurse with a BSN. And the differences between that is, one, of course, the years. A licensed practical nurse, which is an LPN, would go to school to obtain the skill set of working in the hospital. So you can pretty much do everything except for hanging blood. So if that's something that you would be interested in, you can do that. An associate's degree nurse is more so clinical. You're going to go to school for 2 years, and you're going to obtain that clinical knowledge and that skill in order to work into the hospital, in order to work in the hospital. A BSN nurse, that's your 4-year program, and that's actually going to give you all of the knowledge that you need in order to practice as a registered nurse. And what I mean by that is you're going to get your research, you're going to get your chemistry, and you're going to get your leadership skills. Now, research has shown now that yes, ADN nurses are capable of working at the bedside, but you do need that research aspect. So a lot of hospitals are wanting nurses to come in as BSN nurses.
Excellent.
And you're required to take an NCLEX in all 3 of these areas.
Great. That's a very good overview of the field of nursing and the myriad of possibilities. And lastly, last question for you. We mentioned that you can have different healthcare providers in a clinical setting, nurse practitioner being one and a physician assistant being another. What are just some of the basic differences between the two?
The biggest difference, because I mean, we're all going to school to get a master's, we're all going to school to work in healthcare, and we're pretty much working underneath a physician. Only certain states don't require nurse practitioners to work under a physician. So if a nurse practitioner is something you want to do and you want that autonomy, you might want to find a state that doesn't require you to work under a physician. Right now, Georgia is one of those states that does require you to do so. The real big difference between a physician assistant and a nurse practitioner is, as nurses, we are actually trying to do preventative care. You want to prevent an issue before it happens. So if your patient comes in with high blood pressure, you want to prevent that MI, that heart attack, from happening. So you're going to do everything in your power to give that patient that care so that they do not advance into the hospital setting. A physician assistant, they're on the disease process. They want to know that disease. They want to know how it forms. They want to basically break that down when the patient comes into the hospital to then care for that patient.
Excellent, excellent. Thank you. Thank you so much, McFrancis.
You're welcome.
And we'll come back to you during the Q&A session, but thank you for that wealth of information. Now we'll move over to Danielle. I'm just getting set up. So Danielle Bisolo. Hi, thank you so much for being with us this evening. And we wanted to talk to you about your degree. You have a doctorate in psychology, in school psychology. Tell us, what is that? What is a school psychologist?
Sure. So a school psychologist is, in the traditional role, is a psychologist that works within a school system. So you can be placed anywhere from elementary school, middle school, to a high school. And in the school, you're doing counseling, you're doing behavior modification, you're consulting with teachers on academics and behavior, you're doing counseling, and the biggest part of our role is assessing for disabilities to see if kids meet the requirements to have an IEP. So that's the bulk of the traditional role, but there's some other places that school psychologists can work. School psychologists can work in hospitals, in universities, in private practices, but the traditional role, we work in school systems.
Okay, I'm going to ask you a couple more questions and I'll share the screen while we're talking. One of them is, how long did it take you to become a school psychologist? Basically, how long were you in school?
Sure, so you broke up a little bit, but I believe the question was, how long did it take to become a school psychologist?
Correct.
So there are a few different routes to becoming a school psychologist. First, I graduated with my bachelor's from NC State University. Then I went on to grad school. So in grad school, you have 3 options. Either you can graduate with your master's, your specialist degree, or your doctorate. And I chose to graduate with my doctorate, which took me 5 years working, but 6 years technically to defend my dissertation and have my degree conferred to me. So 3 of those years were in class, learning, reading, researching. After those 3 years, we took our comprehensive exams just to demonstrate that we have retained all the knowledge from those 3 years. My 4th year, I did research in an advanced practicum, and a practicum is similar to an internship, but it's unpaid. And then in my 5th year, the last year of my program, I did my internship, and this would be like a residency in med school, but it was only 1 year. So 5 years. My 6th year, I worked as a school psychologist, and I was just holding on to my paper, my dissertation, waiting to defend. And within that last year, I defended. So that's my 6 years.
Excellent. So after your bachelor's degree, then approximately another 5 to 7 years to get that doctorate.
Yes.
Okay. Okay. And a lot of people are still confused about the two specialties here, one being psychology and one being a psychiatrist. Can you just pinpoint a few of the differences for our learners today?
Sure. So the biggest difference is the training, and then also what you're allowed to do once you are a professional. So psychiatrists, they are allowed to prescribe medicine, and psychologists are only allowed to prescribe medicine in a few states. And I think that was like Louisiana, New Mexico, and Illinois. So you don't have as much freedom to prescribe psychiatric medicines as a psychologist. And even if you are a psychologist and you have that extra certification to prescribe, again, it's only in 3 states, and you also have to pass another test and get certified to prescribe medicine. So me working in Maryland, I cannot prescribe medicine. If I moved to Louisiana and took some more classes and got my certification, I could prescribe medicine there.
Okay. Okay. And the length of schooling I see here is, pretty similar in terms of being a psychologist, a school psychologist. It can take 5 to 7 years, possibly even 8, if you do a postdoc. And with psychiatrists is after 4 years of college, then you do 4 years of medical school and another 4 years of psychiatry fellowship. So similar length of time, but it's just difference in the pathway that you take. But thank you so much, Danielle. And we'll come back to you with more questions shortly. So I'll turn now to Kristen to see if there are any questions from the audience before we move on to session 2.
So far right now, we do not have any questions, but I just want to, just in case we're not sure. So if you have any questions for our first panel or our second panel, everyone, you could go right there to the chat box and you can put those questions in, or if you're like me, write them down on a piece of paper so you don't forget them. Okay, you can put those in. So if you didn't get them just yet, you weren't quite sure for our first 3 for this first panel, write them down and we'll come right back to you.
Great. And the only question that I remember seeing from the registration was how COVID-19 has impacted your practice. And Danielle, maybe you could speak to that.
Sure. So this time has been so crazy in the fact that I have not been able to work with kids this school year. I'm seeing them in their classes, like on a Zoom class, just like we are today. And today, actually, I got to do my first counseling session, and we've been in school for almost a month. So it's been really, really challenging, just because that's the best part of this job, is working with kids, being able to be in classrooms, watching learning happening. But I just haven't been able to do that. But as far as my kids, for my middle school guys, they are really struggling with even logging on to Zoom. So we're seeing a lot of absences. Not even doing work on their own time. So really having to work with families and think about strategies for getting the kids on and keeping them on. In elementary school, it's not as bad with the absences, but the kids are very wiggly. You see a lot of tummies and people moving on and off the screen. And it's funny, but you just don't know how much they're actually retaining because they're so distracted by things that are happening in their homes. And they're not in the classroom getting that social aspect of school. So it's very challenging, but we can't go back until it's safe. So we're gonna do the best that we can with what we have.
Okay, thank you, thank you. And later on in the program, we'll find out from Francis as well how that's impacted her practice. Now we'll turn over to Sadia Vaisalo. She is a college senior with a major in public health and a pre-med concentration. So thank you, Sadia, for being on.
Hello.
All right. So tell us a little bit, pre-med major and a public health major. with your public health major, where do you plan to go with that? If you say did not do medical school, what are some of the things you could do with a public health major?
So as a public health major, generally, if you get an undergraduate degree in public health, you also have to get a master's degree as well in order to get jobs within the field. And I'll just highlight three of the, I guess, primary jobs or most popular jobs with that undergraduate and master degree. So the first one is, you could become an epidemiologist. And essentially, an epidemiologist tracks the pattern of diseases. So like the COVID-19 pandemic that we're going through now, an epidemiologist would trace the spread of COVID within various communities. And then the next job is a healthcare administrator. And essentially, they handle all the billing and insurance processing in a medical office or hospital setting. A common job title for that would be a billing manager or office manager. And then the last job is a health promoter. And basically they work in different settings and identify all the various health needs. So a health promoter could work for a company and help the employees work on any health issues that they have.
Great, great. And do you have to be a pre-med major in order to go to medical school?
You do not. You can major in anything from art to history. You just need to get with your advisor and make sure that you take all the science courses required for medical school.
Okay. And wanted to ask about those classes that you mentioned. So I'll turn here. And tell us, what are some of the classes that you should focus on for medical school?
So this is just a recommended list for all the classes that we believe you should take before you take your MCAT and enter medical school. So during your freshman year, you would take English, general chemistry, and pre-calculus. And then we also have some primary goals for each year. And one thing that I want to highlight during your freshman year, it's very important to get in contact with your pre-med counselor to make sure that you're taking all the classes you need before your MCAT and to enter medical school.
Okay. And what about in your junior, senior year?
So the junior year is essentially the year you begin applying to medical school. So during your first semester, you want to develop a study plan for your MCAT and also maybe begin studying. Generally, people study between 3 to 6 months. And we recommend that you take the MCAT in March, April, or May of your junior year. So you may have to begin studying during your first semester. The second semester is when you begin studying or continue studying. And then in the summer, in May, you begin working on your primary application for medical school. We recommend that you turn that in on June 1st.
Okay, we have a little timeline here. And you mentioned the application cycle for medical school. It seems pretty long. So if someone's trying to go straight into medical school, not take any time off, what are some of the stopgaps? What are some of the important deadlines?
So the first one is taking the MCAT during the summer before your senior year. If you do not take the MCAT that summer, you won't be able to enter medical school right after graduation.
Okay.
And also, it's important to turn in your application by June 1st.
Okay. And then what about senior year in that cycle?
So senior year, once you begin, the fall semester generally consists of awaiting interviews from different medical schools and also secondary applications. So individual medical schools will send you secondary applications that you have to fill out and answer more specific essay questions relating to their school.
Okay, so then just to clarify for those listening in, if you want to go to school, say in 2022, you want to start medical school July 1st of 2022, you have to take your MCAT when?
So you would have to take your MCAT in March through May of 2021.
And apply to medical school in 2021. Okay.
Right.
All right. Okay. Well, thank you so much. We'll have some further questions for you shortly. And now we'll turn to Miss Lane. Olivia, wanted to ask you a few questions. Are you muted? Okay. There we go. All right. Excellent. Excellent. Nice to see you, Olivia. So tell us about your current program. I understand you're doing a master's program at Drexel. Tell us a little bit about that program.
So I'm doing a master's program in biomedical studies. And it's a 2-year program included with MCAT prep. And I'm taking physics, biochem classes to boost up my science GPA. And yeah.
Okay, all right. And you mentioned that it's a 2-year program. What are your future goals after the program?
So while doing the program, I'm going to apply to I'm going to take my MCAT, apply to med school, and after that, get into medical school, and I want to become an OBGYN.
Excellent, excellent. Okay, and you're on your way there for sure. Now I'm going to share a screen because you mentioned, taking that time off between college and med school to do your master's program. And some people may call that a gap year. So I wanted to find out from you, what are some of the other options that you hear students take during that time?
So usually, well, from my graduating class, I can speak for them. Some people took a year off studying for the MCAT. Some people volunteer, some people work, but at the same time while studying for the MCAT. Some people have taken the MCAT, but are not happy with their scores, and so decided to do a gap year, a post-bac program. And yeah, those are some of the things that some people are doing right now.
Okay. And what would you say back in college? I know what one of the classes that you felt may have best prepared you for where you are now, if you could choose one class that best prepared you?
I'll say biology.
Biology, okay. All right, great, great. Thank you so much, Olivia, and we'll come back to you as we ask further questions about gap year and other choices as well. So we'll move on now to Sydney Ray, who is a third-year medical student. And Sydney, I'll let you tell us where you are in school right now and a little bit about the medical student experience. We can hear you now.
I have my microphone on, so if it's not working, just let me know. So I'm a third-year medical student. I'm at the Kansas City University, it's the longest name, Kansas City University College of Osteopathic Medicine. And so I finished 2 years of didactics, which is basically studying school all the time. And now I've started my clinical rotation. So I am in the hospital right now.
Okay. And when you're in the hospital, what do you do? Is it like Grey's Anatomy where we see people running around and tell you to bring the coffee? What are you doing?
So it's not like Grey's Anatomy. So you basically have several different rotations, and you spend about a month on each rotation. So you have like core rotations, and those are pretty much standard, whatever medical school you're at. So some of those would be like surgery, OBGYN, peds. So far this year, I've done peds and I've done electives, which I have gotten to choose. And I chose radiology and hematology and oncology.
Excellent. Do you have time to just, veg out, party, go out, or are you just studying the whole time?
So I have way more time this year, just to be like a little bit of a being. There's a lot of studying. Like you are studying a ton first and second year. But I personally think it's really, really important to find time to take off. Like, for example, first year, I made sure to take every Friday evening off, like no matter what, like I always took it off. And then I always find time to watch Netflix no matter what. Like sometimes I just keep it on in the back, like to hear another voice. But just one piece of advice that I actually heard when I was on a panel, the very beginning of my first year was, like, don't forget to do the things that make you a human being. And this particular person said that she would have, taken a little bit of a hit in her grades, just to make sure that she kept volunteering and doing those things that just make you a human being, because I feel like that makes you a little bit more connected to your patient. I mean, you need good grades too, obviously, like don't make bad grades, but make sure you're doing other things too.
Excellent. And then one last question for you. You mentioned you're in osteopathic school. So I'm going to share a screen here so you can share with getting the audience what that means. Okay. All right. And you can start talking whenever you're ready.
Yeah, so a lot of people don't know this, but there's actually 2 pathways to become a physician. And they're almost exactly the same. The only difference is that as a DO, you have to take an additional course called OMM. It stands for Osteopathic Manipulative Medicine or Therapy. You might see OMT sometimes. And it's a hands-on technique that we learn. You might compare it to a little bit of physical therapy. You learn techniques like soft tissue, which is similar to massage. And it's just a way to treat the body itself, so that you, because when your bones hurt, your muscles ache, sometimes it hinders you from healing. So it's a way to treat your outside body to help treat your inside body, basically, but you still learn everything else. And it's great because you get to practice, getting comfortable touching your classmates first, so that when you actually are touching patients, it's not so awkward.
Okay. So both 4 years of medical training with residency. Exactly. Excellent. Excellent. Well, thank you, Sydney. And again, we'll have further questions for you in a little bit. And so I'll turn now to Dr. Fasia Weislow. Fasia, thank you. She is a resident at Morehouse School of Medicine right here in the ATL. So we want to welcome you. I know you're tired. You're currently working in the ICU as a resident. And so tell us a little bit about your day just today.
Well, hello, everyone. First, a day for me is a lot of work. You wake up about 4:30, go to the hospital, round on patients, write notes on patients, and then round with your attending. Because I'm a resident, while I do have my own patient panel, I do see my own patients. I'm a physician, but I'm not certified. So we have to work under a certified physician. So that means that, we see patients, we write medications. However, we run everything by our attending physician, and they sign off on everything that we do. So after seeing patients, rounding with our attendings, they leave the hospital. We stay there 24/7. But after getting up at 5, I work until about 6 in the evening in the ICU. And then the nighttime resident comes on when I leave.
Wow. Well, thank you. Thank you for being here. We know how tiring that is. So are there some rotations where you have to spend the night in the hospital?
Yeah, so at Morehouse, every residency program will be somewhat different, but there's always a resident in the hospital. So for our program, we have a day team, which I'm on right now. But when I'm not on the day team, I do have weeks where I do night shift only. And then I have days where I work 24 hours, so 7 a.m. to 7 a.m. And then there are also short calls where you're there from 7 a.m. to 7 p.m. But there's always one of us there, regardless of what shift we're on. So, yeah.
All right, I'm going to share a couple of slides here for the last couple of questions with you. And one of them is just about choosing a residency. And I know Sydney touched on a little bit about the first couple of years of medical school, but did you have to take exams? Like, how do you get into a residency program?
So yes, so I guess I'll start where Sydney left off. 3rd year of medical school, when you're on the rotations, you kind of get a feel of what type of medicine you want to practice. For me, I like a little bit of each of my rotations. So that led me to family medicine, which I already had a passion for anyway. So after deciding what I wanted to do, I had to take my Step 2 boards, which is required for your application into residency. And depending on which program you go to, your score will matter for that program. But you have to take your boards. You have to pass both your step 2, which is a written test, multiple choice, and then you have to pass the physical portion of that also, the PE, which is you have to go in person and have a full physical encounter with the patient, or multiple patients, and you get tested on that. So after passing those, you apply to residency. Once submitting your applications, you rank the residency programs that you interviewed at, and then they have to rank you also. And there's a matching system. And if that system matches you with the programs that you've selected, and hopefully they've selected you also, then you'll match into a program and that's where you'll go.
So ending.
Yeah.
What I'm hearing as far as the exams and the board certifications and the ranking and so forth. But thank you for that. And I know people have questions about your family practice residency. It's 3 years, but others are longer. Tell us a little bit about that.
So in family practice, we rotate with all of the other specialties. And so some of my colleagues that are in surgery, they actually have a 5-year residency. And so for them, they'll actually do 1 year of a preliminary year, which they do basic medicine. Some of them will do internal medicine, and then they'll go into their surgery residency. For pediatrics is 3 years, and we work with them also. And so you'll find no matter which residency program you're going to, you'll end up working with some of the other specialties, which is important for practice.
Okay. And then lastly, the big question, how long does it take to become a doctor?
So you have 4 years of high school, 4 years of college, 4 years of medical school. Traditionally, if you go straight through, you'll have the 4 years of high school, 4 years of college, and then medical school. For me, I did an additional 2 years in between college and medical school, so I had the gap year. And then you have 3 to 5 years of residency, depending on which specialty you decide to take. And then if you want to be a specialist and you want to be, you have specialties within a specialty. For example, if you want to become a general surgeon, you may only have 5 years of residency. But if you want to become a cardiothoracic surgeon, you'll have a fellowship that you'll have to do. So that's an additional 3 to 5 years, depending on which specialty you decide. So all in all, you have anywhere from about 15 to 20 years, maybe even more if you want to specialize further. So you have to be dedicated and really have a passion for it to withstand all of it.
Right, exactly. No, thank you so much, Fasia. Before we move to the final Q&A, just wanted to highlight a few things. And one, we haven't talked about money during this discussion, but I think it's very important that we talk about the financial burden that you may take on if you go into any of these fields. And we encourage you as you're learning to look up salaries. These are some of the websites you can go to, and also look at the cost of the schools that you will be attending, whether it's becoming a nurse or a CNA, a medical assistant, whether it's becoming a nurse practitioner, a physician, a psychologist, and really look at what it's going to cost you, what your salary will be at the end, and are there any other options such as scholarships that you can take or loan repayment programs so that you come out with a healthy financial umbrella over you and you're not burdened with a lot of debt. Or if you do have debt, which sometimes people call that good debt, that you are able to pay it off in a good time frame, a reasonable time frame. So with that, I'll turn over now to Kristen so she can start the Q&A. Thank you, everyone.
All right. This has been so awesome. Now, I don't have a background in healthcare, but I'm thinking like, ooh, you all are so committed. And I just want to say my hat goes off to all of the awesome ladies that spoke tonight. That is definitely commitment and heart. So we have a few great questions, and I want to actually just kind of back up, and then I'll start from the beginning and we'll work our way down. And if they have a particular person, I'll just highlight that panelist. This question is directed to Sadia. So Sadia, get ready. Sadia, this is from Amelia, and she says, I'm currently a health promotion and behavioral medicine major at UGA as well. And she says, I was wondering what types of research you did, or what type of research you look for, and do you find research related specifically to public health?
That's a really good question, because I think when you're applying to medical school, a lot of people think you have to do biology or chemistry research in the sciences. So I decided to do public health research, and I did that through my capstone. So during your senior year at UGA, you'll have to complete a capstone, which involves an internship at some type of clinical or health promotion setting. And then also you'll have to do research and present on that research. So in the spring semester, I'll be at Mercy Health Clinic, which is a clinic for low-income individuals, and I'll be conducting research there as part of my capstone.
Awesome, Sadia. This next question is for McFrancis. Would you recommend nursing before pursuing PA school? And is there a bridge between the two? Is McFrancis there?
Oh, I have to unmute her. There she goes.
Oh, okay.
Okay.
And that's actually a really great question that I've heard a few times. So what I would say is no. It would actually be a waste of your own time to do that, and I'll tell you why. Figure out what it is you're passionate about in healthcare before even delving into anything. I can tell you I've seen many nurses do that. It's a completely different path. So it's like starting over. Like I said before, when you want to become a PA, it's going into the disease process. You're interested in the disease. You want to know how that disease works, where it comes from, what population it affects, and how you're going to work with it. With nursing, it's preventative care. That's all we really focus on. Yes, we have to do the same things that you do as far as understanding the disease process, but we're trying to prevent that. And also, it's a lot of education in nursing. So if you're not the kind of person that wants to talk to people all day or be very repetitive, you may not want to do that because you're spending about 99.9% with your patient population as opposed to the PA, who is just going in to check on the patient. You're writing orders, you're telling the nurses what it is they need to do. But even as a nurse practitioner, you're spending way more time with that patient than the physician is. And also that physician may give you orders as the nurse practitioner as what it is they want you to do with that patient. So really kind of delve into that and see what area it is you want to go into and what it is you're willing to do with the patient population that you are going to focus with.
Excellent.
Awesome. Thank you so much, Francis. This next question is for Danielle. Danielle, this is from Maggie Rogers, and she says, I'm currently completing my undergrad at UMBC. I want to eventually be a school psychologist as well. Do you recommend that I go right into graduate school?
So as a psychologist, you'll find that when you ask us a question more in response. So I would want to know, why would you want to wait? So do you want to pad your resume? Do you have some life things going on? Do you really want to see or get some more experience working with children? So just trying to figure out like why you would want to wait. But I would say go for it. I went straight from undergrad into my doctorate program. And a great piece of advice that I got while I was applying was that the time will pass anyways. So if you're apprehensive or you're nervous about going to grad school, or you think it'll take you too long, those 5-6 years will pass anyways. So I'd also want to know if you wanted to be a specialist or a doctorate level, because if you did take a break and you wanted to take some time off and you wanted to go into a doctorate program, I would recommend getting into some research. Just like Sadia was mentioning, that she had an opportunity to do that with her capstone. While you're in undergrad, making sure that you're looking for the psychology program, any professors, and asking them if they're working on any research. They love to have people in their labs. When I was in undergrad, I did research on reading programs, so reading interventions to help kids with their reading fluency. That looked great on my applications, that I already had some intervention work under my belt. So if you're going to take any time off, just make sure that you're using that time to make yourself more competitive when you're applying to grad school. And you can do that with research, with service work, but making sure that it's within the field of education. I think that answers the question. Is that it?
Awesome. Yes. Danielle, and you have kind of a second part while your microphone is open. You have another question out there, and this question is so good, especially for the pandemic that we're in. Danielle, how are you working with kids who have IEPs during these times because of, maybe attention and hyperactive issues?
Right. So it's become more minimal what I'm doing with the kids themselves. But I'm spending a lot of times in IEP meetings and in community meetings with teachers and other educators, discussing strategies, working with families. So it's a more holistic approach now, since I can't be in the classroom with the kids, working with teachers. So meeting to give strategies and make plans to help those teachers who are face-to-face with the kids on Zoom. One way that I'm planning to help more directly, I was on a 4th grade class today, and the teacher was really, really stressed out. She had a headache, cold in her head. A kid was not clicking on the right button. She was just so frustrated. So I offered that teacher, hey, next time I come to grab my kid for counseling, is it okay if I grab this one so they can come with us too? Just to alleviate some of the stress that the teachers feel, because they are all so stressed out over virtual learning. But really, you have to be really creative during these times when it comes to addressing those IEP goals.
Thank you so much, Danielle. This next question, we're getting some good questions. This next question is for Sydney. Sydney, get ready. Sydney, are there certain study tools or apps that helped you while in didactic year?
Absolutely. So a great resource actually is going to be someone who's in the class above you, because they're going to tell you what they did, and every school is a little bit different. So they're going to tell you what they did and what helped them. And, certain things that certain teachers like to ask, or certain ways they like to ask stuff. So never underestimate your classmates or, classmates above you, because they can be of some really, really great help. Now, in terms of actual resources, I have 4 absolute great ones that are probably used amongst almost every medical student. So one of my personal favorites, it's a free app called Teach Me Anatomy. It's great. It's got fantastic for anatomy, and it's got clinical relevance in it. So I love that app. I used it all the time first year. And so second year, my class, the way we did it was a little bit different. We did physiology and anatomy first year, and then we did pathology, clinical stuff second year, and we did every class twice. So we had like a gastrointestinal class twice, which is pretty different than a lot of other schools. But so for that year, I did Pathoma, fantastic source, Sketchy Medical, amazing. I don't know how I would have gotten through without it. And then there's this called Zanki, Zanki, and it's pre-made flashcards, and they go along with those resources. So it has Sketchy flashcards, Pathoma flashcards that I use, and it's nice because it's pre-made, and there's so much material that it's almost impossible to make your own flashcards in medical school. But those are all really, really great, strong resources.
And Sydney, while you're there, you have another question. The question was from Martha, what will be your specialty for your residency?
So that's a good question. Right now, I really, really like OBGYN. And the only reason I know that is because I had an internship in high school where I was not like thinking of OBGYN at all. And I went to it and I loved it. So that would be another piece of advice I have actually is you don't get to see the field as much as you think you would in med school. Like you have about 1 year to see everything and decide, and it's a quick turnaround. So I would actually suggest to do as much shadowing in as many fields as you can in high school and college, which I just didn't even realize until I was actually here.
Oh, very good. Thank you so much, Sydney. All right, our next question for our panel who has residency experience. So they say, is residency the first point when you start earning money? Or are you still paying for some type of schooling during this time? That's a good question.
Yes, and more yes. You get a stipend in residency, but that's the first sight of money that you get. It seems like a lot of money, so be careful. Don't do too much, because you also start paying student loans back in residency if you have them. So yes, it's the first time you start to get money, but you start paying loans also.
Wow.
All right. All right, our next question is from Madeline. She says, I was wondering if you had any advice for a college freshman in terms of volunteer work or summer activities. Madeline is a pre-med student in UGA, and she's looking to go into to medical school to become a dermatologist.
So I know it's super hard right now, especially with COVID, to find volunteer experiences that are in person. But there's a lot of virtual volunteer experiences going on through various hospitals. And I don't know if you're a part of the pre-health email list. And basically they send a weekly email with all the club opportunities and volunteering experiences at the school. And so I would join that. If you haven't, you can just search the UGA pre-health office on Google and it should come up and you'll be able to join the email list. And then for summer opportunities, I would really recommend doing some kind of program through a medical school. A lot of medical schools offer summer programs for pre-medical students. And basically what you do there is you have the opportunity to shadow, even take some introductory medical school classes. They often have free MCAT prep as well. And it just allows you the opportunity to network with different administrators at the school. And I think it's a really good experience.
Thanks, Sadia. This is some good stuff. Okay. Now, everybody loves Pacia tonight. As a resident, here's your question. Do you have any downtime for yourself? Or are you constantly on the go? So Evelyn wants to know, do you have a chance as a resident to just kind of relax and enjoy friends and family?
No.
He's honest.
And Fasia, what do you say as well?
I think she's muted.
Oh, okay.
So as McFrancis said, there's not a lot of time for family. However, I echo what Sydney said earlier, that with the little time that you do have, you kind of have to set your priorities with your priorities. For me, you know, my religion first, God first, my family, and then my career. And so I approach things that way, but there are times when you can't control it, when you get called in or when, you know, you have responsibilities that you have to meet. So I don't have a lot of time, but I make time here and there.
Very good. Gotta make time. Gotta make time. Take care of yourself as well. This is a good question for our panel, for anyone, but let's see who can answer this. Do you think there is a lot of room in healthcare for creativity? And if so, in which profession specifically? That's a good question. That's from Melissa.
Well, I love that question.
Mm-hmm.
I actually have it both for nursing And for medical doctors, I have 2 colleagues as well as friends. One is a nurse practitioner. He is a nurse anesthetist. They both live in Miami. The nurse anesthetist, he actually uses his job as part-time, really because he has partnered with the anesthesiologist who he works with, and they do IV infusion therapy. And what they actually do is they have a service where, say you're having a bachelorette party, say you're going to Vegas for the weekend, and you and your friends want to have a drunken weekend. You guys want to have a big celebration. You can actually hire them, and they will fly out to you and provide IV infusion therapy to you while you're on vacation. And then another example is a friend and a colleague of mine. He is a medical doctor, family medicine practice, and he has actually started his own CBD product line. And he's actually partnered with, I know a lot of you guys know him, Flo Rida, the artist in Miami. He partnered with him, and they're actually now colleagues, and they do this CBD product out in Miami, and they're actually global now. And he's actually started his own mobile COVID testing. So on top of being a physician, has his own CBD product line, and he's working with a top hip hop rap artist, and they're partners. So when I tell you the fame and the creativity is out there, healthcare has that area, and it has that niche for you.
I would have never thought. Very good.
Yeah, very different, Kristen, from when we started out. But yes, there's definitely a lot of ways that you can kind of morph your career choices. Once you become a physician, you can go into public health. I worked at the CDC for several years, left practice temporarily, joined the CDC. You can work in telemedicine now, which is such a great need with the COVID pandemic. So you can do that. You can become a consultant, as I'm doing now. You can work internationally in the global field. Same for nursing. So there's so many options out there, and it's not strictly in the hospital or in the office setting. There's so many things that you can do. There's so many nurses who work in public health, who work with the CDC, they work overseas. They are administrators. They do not only clinical work, so there are definitely a lot of options. We have about 5 to 6 more questions. We know the presidential debates are starting soon. We wanted to give you a few takeaways, and we'll try to address 1 or 2 questions just so we don't lose everyone. So I'll start with some of the takeaways that we've heard today from our panelists, and it's been wonderful. I want to thank all of our panelists again. But some of the takeaways for those of you listening: 1 is to prepare and to research. It's so important. Yes, we have this panel discussion, but it's really up to you. You have that passion for pursuing a career in healthcare. And so we want you to take this time to really research all the different possibilities that exist, how long it takes, what it involves, what are my deadlines, so that you prepare. Financial planning, as we discussed earlier. Is this something you can afford by yourself? Are you going to need help from family? Will you have to take out a loan? And ask questions. As Sydney mentioned, do not be shy. Do not be afraid to ask your colleagues, to join clubs, as Sadia mentioned, pre-med clubs, other societies in your setting, so that you get all the information you need. Do not sit alone. Identify a mentor, whether it's a student who's a senior and you're a freshman, whether it's someone who's practicing in the field that you want to go into, you want to volunteer and shadow, and is this what you see yourself doing in 10 years? So with that, I'll go back to Kristen to see if there are any last minute questions. We do want to connect with you. In the chat box, we have included our registration link. And also we ask you to fill that out and answer, do you want to hear about other topics and upcoming events? And we hope to have males next time as well represented, have some men on the panel as well. But I'll turn back over to Kristen to see if there are a few more questions. Thanks, Kristen.
Thank you, Dr. Bisolo. And thank you, Sydney. If you check the chat, everyone, Sydney has some good information for us all. This question is for Raven Berry. The question that's in the chat is, what type of courses did you take as a high school student pursuing your CNA license at the technical college?
She's muted.
There we go. Okay.
So the courses I had to take, I took anatomy and physiology. That was probably the best class I ever took. I love that class. I also took medical terminology, introduction to nursing. I remember those three. I also took, it was another nursing class I took, and yeah, fundamentals of nursing.
Okay.
One more class. I can't really remember, but those are the main courses that you had to take.
Excellent.
Thank you. Thank you, Raven. All right, so we're heading on down. This question is for McFrancis. Is nurse practitioner field saturated?
Yes and no. And the reason being is because there are a lot of people who, are going to become nurse practitioners. But like I said before, with nursing, you have to decide what it is you want to do in nursing because there's so many fields. So using myself as an example, I'm a family nurse practitioner. I can't apply really to hospitals. I mean, I can, but it'll be hard for me to apply to a hospital to become a family nurse practitioner, more so because it's clinical. So they want you to have critical care experience. So if I wanted to do that, I would have then to then go back to school, do an additional 1.5 years to get that certification to be a critical care nurse practitioner. So if you're going to be an NP and you're noticing that there's a lot of jobs that require you to have experience, some of them want you to have between 2 to 5 years of experience before they'll even take you on. That may not be something that you want to do if there's no one out there that wants to train you. As opposed to critical care at the hospital, they need you. So if you know you can get in, you can get the training and get the experience, you might want to go that direction because you can get hired, as opposed to becoming an FNP and just sitting around hoping for someone to hire you. So those are kind of things. And also mental health. That's another area that's hiring like crazy right now. So you really want to do your research.
Thank you, McFrancis. And I think, excuse me, Evelyn Taylor's going to have our last question tonight. Also, if you have another question that just kind of pops up in your mind, Dr. Beislow is also going to list her contact information so that you can continue to send your questions, and Dr. Beislow will get those questions answered for you. And this question comes from Evelyn, and she says, hello, everyone. I currently started working as a CNA. Would that qualify as enough experience, or would you all suggest still shadowing a doctor as well for medical school?
So I don't know if Sydney's probably better to answer that, but I'll give my 2 cents, that it's always good to shadow. It's always good to go and see a physician in the role that you may want to be in one day. For me, I did family medicine because I knew I wanted to do family medicine. But as Sydney said, going to different types of physicians to shadow is important if you're going to go to medical school. So I'll let Sydney answer.
I mean, yeah, you have to, because they're going to ask you on your application about your shadowing hours. They'll probably ask you when you're interviewing, and you're going to need a letter of recommendation from a physician. And for me, I had to have a letter of recommendation from an MD as well as a DO, because I applied to DO school. So yes, both for your personal benefit and because you will have to.
Thank you so much. Well, I hope everyone, our panelists are just awesome. Thank you so much to our panelists, and I hope that you have your questions answered. Dr. Beislow?
Yes, thank you so much, Kristen, for moderating tonight. You've done, as usual, an awesome job. We appreciate you. And thank you to all of our panelists. Everyone has been wonderful and hopefully have imparted some great knowledge to our learners and our attendees. And thank you to our attendees as well for being a part of this program. We hope to have more in the future. We're planning one for just those interested in the nursing field, and hope to have a nurse anesthetist, some nurses who are doing things other than just clinical nursing, who are working in administration, to join us as well. We know we shared a lot of information, a lot of slides tonight, and you can access those slides by registering. I've placed the link again in the chat box. So if you can go ahead and register using that link, ask any questions or ask us for a copy of the slides, we'll be more than happy to share that with you. So we want to thank you again, and thank you again, Kristen. I'll let you close out.
All right, thank you, Dr. Bisolo. And I just want to say a big thank you to our panelists. Come on, everybody. I know we're on mute, but everybody's gonna give them a round of applause. They have been working hard and had either had classes today or you're working. But one of the key things that we pulled from tonight is that healthcare is a field of commitment and heart. And the ladies that we saw on our panel, and Dr. Bisolo as well, she just exudes commitment and heart for others. I just want to thank you on behalf of those who are in your care and in your service. We are so grateful for you all answering the call to healthcare. Well, everyone, I hope that you're taking a look right there in the chat. Make sure that you register and send any more additional questions to that link that Dr. Bisolo has for you all. And I hope that you all have a very good night. Everybody take care.
Thank you, everyone. We'll leave the chat up for a second so you can get that link.